Who gets? The microphone is on. Yeah, I'm going to introduce Beth. Perfect. They're rolling credits.
I stand all the time.
Do you want this out of the way?
Yeah, it'll be great. I don't. Great. And I don't need to press anything.
Oh, take your name tag off.
Okay.
Perfect. The lights cause it to like shine. So,
So you don't want to light up my
right,
face.
exactly.
The Columbus Metropolitan Club was founded in 1976 by 13 women leaders who wanted to be included in the community conversation. I am Sally Bloomfield, and I was one of those 13 women. Having been left out of men's clubs that focused on community issues, it was a priority for us to make the club 100% inclusive.
Today, CMC presents public policy forums every Wednesday at lunch with average attendance of more than 200 people. I'm Tony Bell, and I frequently attend forums, which are open to everyone and present relevant, current, and newsworthy topics. I'm grateful that CMC is nonpartisan and presents many perspectives on every topic.
I'm Jane Scott, President and CEO of the Columbus Metropolitan Club. CMC is open to everyone. We invite you to explore the personal and professional benefits awaiting you at the Metropolitan Club. Welcome to CMC.
Welcome to CMC.
Welcome to CMC.
Welcome to CMC.
Good afternoon and welcome to the Columbus Metropolitan Club. I'm Steve Marks, Chair of the CMC Board of Trustees and President of Hannah News Service here in Columbus. It's my pleasure to welcome our in-person audience today and to say hello to all of you who are watching via our live stream. Let's begin by meeting our new CMC members. Sarah Bongiorno from Planning Next, Allie Grew from COSI, Julia Johnson, Doreen Whitley Rogers from ESRI, Carmine Russo from Realm Collaborative, and Eric and Mark Wagenbrenner from the Thrive Companies. Let's welcome them. We'd like to invite you to join CMC. At just $16.95 a month for individuals, CMC membership is an investment in yourself professionally and in our community. Your membership also supports the not-for-profit Columbus Metropolitan Club. CMC members like you inspire our Wednesday forums and are a critical part of the community conversation. Thank you. Thank you to today's forum sponsors as well, the Ohio State University Wexner Medical Center and Health Sciences Colleges. And today's CMC live streaming is presented by the Emergency Response Fund of the Columbus Foundation in partnership with the Columbus Dispatch and PNC. Thank you all. We'd like to also thank those of you who purchased a virtual seat for our forum today. We're very grateful for your continued support. You can learn more about CMC, register for events, Join or renew your membership, purchase a virtual seat, or make a donation anytime at columbusmetroclub.org. So right when they needed it most, we were told to keep socially distant from the frontline responders who are facing their most stressful days caring for those with COVID-19. But at the Ohio State University Wexner Medical Center, a new type of coworker of a four-legged variety was stepping in to provide care and comfort and companionship. Today, we'll hear how the innovative Buckeye Paws program is a bright light for nursing staff and patients, and how research shows that programs with therapy animals improve the mental health and resiliency of critical care staff and other people in stressful environments. I'll introduce the panelists by name and position. You can find more about each of them in your forum flyer today. Please welcome Dr. Rustin Moore, DMV, Ph.D., Diplomate, ACVS, Dean of the College of Veterinary Medicine. He is also the Ruth Stanton Chair in Veterinary Medicine at the Ohio State University. Nechelle Marlowe, RN. She's a nurse manager with the OSU Wexner Medical Center. And Dr. Bernadette Melnyk, Ph.D. There's a whole lot of initials. She is Vice President for Health Promotion, University Chief Wellness Officer, Professor and Dean, College of Nursing at the Ohio State University. And our host today is Gail Hogan, the famed journalist you all know. But first, Beth Steinberg, Staff Wellness and Development Coordinator and co-founder of Buckeye Paws, will give us a brief overview of the Buckeye Paws program and its creation. Beth?
Thank you. As he said, my name is Beth Steinberg, one of the co-founders of Buckeye Paws, along with my work colleague, Mary Justice. Buckeye Paws is a therapy dog program that's solely dedicated to the health and well-being of our faculty and staff that work across the OSU Wexner Medical Center. A couple years ago, when Mary and I were training our dogs, we talked about how we might bring a program like this to support our staff health and well-being into the medical center, knowing that, we have a very difficult environment, lots of sick patients. We wanted to make sure it was safe. Interestingly enough, a couple years ago, about 8 years ago to be exact, that the concept of this program was started in our surgical intensive care unit by two nurses who had a passion for therapy dogs. They watched as nurses were benefiting from the therapy dogs that actually came in to see the patients. They saw their mood lighten, they saw them laugh and smile, they actually saw their anxiety lessen. So they did a little mini study, presented it nationally at our National Teaching Institute for the American Association of Critical Care Nurses. And Mary and I took those concepts and built the Buckeye Paws program that you know of today. Emily Lewis, one of our surgical intensive care unit nurses, and her therapy dog, Ellie, were the third dog of our founding team of 3 that started in March of 20, so right before the pandemic. We now have 13 team members, Buckeye Paws. Some of them are here today with us. All of them have day jobs. They're all employees of the medical center. All of them volunteer their time to support their colleagues' health and wellness. I will recognize Lindsay Pefferly. She does not have a therapy dog, but she's a very busy OR nurse and mom who follows us around as our official Buckeye Paws photographer. So she's snapping photos today. She documents us wherever we go. And then Amy Mitchell, our brand new program coordinator for the program, is here with us today. Our first paid employee who does everything for us behind the scenes, from recruitment, scheduling, and she is also our social media guru. So we do have an Instagram account for Buckeye Paws. So our current plans include expansion into the health sciences colleges, and then future plans to expand across the OSU campus for students and faculty there. So thank you again. Gail?
Thank you all, and yes, it is a joke that we've heard very often that you are never supposed to share the stage with children or dogs. Well, today the show is going to the dogs, but in a good way, and we appreciate that. And Beth, when you said they have day jobs, at first I thought you meant the dogs. I went, oh, well, they sleep, I suppose. I don't know what else their job would be. Research has shown that animals in general are great stress relievers, and stress relief was the reason for the formation of the Buckeye Paws program, as we just heard. So today we're taking a look at some of the research to discuss the emotional and mental challenges of working in a hospital environment, specifically during the pandemic, and ways to relieve that stress and burnout. And Dr. Melnyk, I'm going to start with you because you have some wonderful insight into the stresses that these folks feel that it's placed on doctors, nurses, medical staff. What has your research shown?
I first would like to start with a dose of vitamin G for gratitude to Mary and Beth and all of the whole team, because you all are pioneers, and these dogs have brought so much stress relief and improved mood to our clinicians. Even before the pandemic, the National Academy of Medicine declared a public health epidemic because the mental health, depression, burnout, stress, suicide of doctors, nurses, and other healthcare clinicians was so high. Then the pandemic hit, and now we have a mental health pandemic inside of the COVID-19 pandemic. My team did a national study of critical care nurses last year. We found such high rates of depression. 40% of the critical care nurses were suffering with depression, 52% with clinical anxiety, and 60% reported poor quality of life. Yet, the nurses who perceived that their work sites supported their wellness had much better physical and mental health outcomes. So we at Ohio State, I'm not sure how many of you know, but we were the first university in the country to appoint a chief wellness officer. And my job is to improve the mental health, the physical health, and the well-being of faculty, staff, clinicians, and students all across campus. We truly are a model for other universities and academic medical centers across the country with what we do.
Well, for those who think something like a wellness officer isn't necessary, you can just ask someone like Nechelle, who was on the first lines of defense for COVID patients, continues to do so. Nechelle, can you share some of your experiences of what you went through and continue to go through?
Good afternoon, it's not morning. Our experiences in our unit, we had some really long days, long hours. At one point, we were 100% fully COVID positive. And at that point, we needed to decide how were we going to support our staff. Our staff members were working long hours. They were stretched really thin, very stressed. How could they even debrief, de-stress? What does that even look like? When they go home, what does that look like? We're in the midst of a pandemic. Some of them couldn't even be with their loved ones a lot of times. So there was a lot of weight and the burden that our nurses were covering. So now that we had the Buckeye Paws, a lot of times they would come to the unit. Sometimes the visits would be brief, but just if you could read the room, you could just see that there was just a sense of relief. Sometimes it was just a view from the door. A nurse would be within the room with the door shut, fully garbed in all their COVID attire. But it was just that little bit of an interaction just to see the dogs. When we got to the point where they were more hands-on and the dogs were on the unit and they could be loved and petted and all of that, you'd see more staff on the floors, even though you would sometimes be like, no, don't sit on the floor is dirty. But a lot of times, that's just how it happens. And so sometimes there are very specific people who are requesting certain dogs by name because there's a special connection there. Other times, it's just knowing that they're coming and then they're really excited. And some people sometimes aren't necessarily dog lovers, but they love having the dogs there because they can feel that sense of enjoyment, that euphoric of feeling when their peers are around the dog. So those are some of the experiences that we've had.
Thank you, Nechelle. And the pups are back there in case you haven't seen them. There's a few tail wags. Otherwise, they kind of look pretty bored with what we're talking about up here. Dr. Moore, now we're to you because we're talking about pets, not just dogs, but animals as comfort creatures. You've had a lot of experience with that. What have you found?
Well, there is a term that's been coined called Zooeya, Z-O-O-E-Y-I-A. And it's really a term that really talks about the importance of the interaction of people with a pet on their health, and that's physical, mental, social, behavioral, emotional, and psychological. So the things that I'm going to talk about today are really, I'm going to talk about why the emotional part, and really it does change brain chemistry. So if you are interacting with a pet, even intermittently, petting, holding, or even gazing into the eyes of a pet or a dog, your brain will release both dopamine and serotonin, which are feel-good hormones. You also release oxytocin. Oxytocin is sort of that bonding hormone that mothers and their children that's released. It's released in both the mother and the baby. It actually happens for the fathers too when they're interacting. So those things, and then there's also a decrease in cortisol. And the good news is you don't have to have a pet or stay with it all the time. That intermittent interaction really does help. So that's really the reason behind it, at least based on the research. And you know, I have to imagine, and I was trying to look this up before I came, but you know, post-traumatic stress syndrome affects about 8% of people in the U.S. and about 30% of veterans. And I don't know what the percent, I'm sure Bern can share that with us, what the percent of healthcare workers have PTSD, post-traumatic stress syndrome, or stress symptoms. And you know, that can happen for a variety of traumatic reasons. It doesn't have to be simply a combat zone or a natural disaster. So if you think about what people might have been going through before the pandemic and whatever baseline level of PTSD there was, I would imagine the PTSD level went way up. And that's because people, nursing and other healthcare workers, were seeing a lot of really seriously ill and dying, people dying in the absence of their loved ones, and the nurses and others were the conduit or the liaison of that, saying goodbye sort of thing, and all these other things. So if you think about it, and this is my last comment on this topic for now, there is a study that has shown when you unite a veteran who has PTSD with a service dog or a therapy dog, they have fewer psychiatric symptoms and less severe symptoms, less substance abuse, and they require fewer medications and lower doses of medications to manage the PTSD. So I'm trying to take that analogy and apply it across, which is, I know, very different, but PTSD is PTSD caused by different things. So I'd love to hear what Dr. Melnyk says about that, because we did not rehearse this.
Well, Dr. Melnyk, you are a big believer in advocating for stress relief for the health workers because of things like, PTSD. A program like Buckeye Paws, does your research show that it has a long-term effect, or is it just a feel-good moment?
It definitely has a longer-term effect. I have to address Rustin. He's my dear friend and buddy. But we have a philosophy, and that is, in God we trust, but everybody else better bring data to the table. And right, Rustin, isn't that correct? So what we do at Ohio State is from a strong evidence base. That doesn't mean we don't innovate too, like Buckeye Paws. But for an innovation to really stick, you got to gather evidence behind it. And I'm committed to working with Mary and Beth and the team to get more wonderful data on Buckeye Paws. We've got studies to show long-term good mental and physical health outcomes from interacting with pets. I'm a pet lover, so when Mary first brought Shiloh to my office, I, by the way, have 2 character-building pugs in my house. And my daughter is an equine vet. So I am a big believer of pet therapy, but it does have fabulous evidence behind it.
That's crazy. That's great. It's wonderful. Nechelle, you experienced a lot of stress, and some of your coworkers around the country left the job of nursing because of the stress and dealing with COVID. How did you stay on the job and continue on the job and move forward?
I would believe that it was really based upon my team. I had to stand strong and be there to support our team for whatever they needed. So I feel like that was my place, and that's how I stayed strong, is to be strong for them.
Did you get reciprocated from them knowing that you all worked together as a team?
I think more than ever during this pandemic, that's where we pulled together the most. I think that's where our teamwork really shined.
Dr. Moore, we've been talking about dogs, but what about other animals for comfort companions? Do they all work the same? Is it different? I mean, and what other animals are suited for this?
Actually, probably just about any animal. And if you think about this around the world, different cultures, have different views about different species of animals. But, in the U.S., dogs and cats tend to be the most common pets. And but there's a lot of research actually also on cats improving, and certainly there's so much evidence that continues to build. So, for example, those individuals who have dogs, and this is by 3 different studies out of Sweden, have higher survival after stroke or heart attack if they have a pet. And there's also evidence, the same with cats, at least in women, with regard to heart disease. So other species also, so it could be, a turtle or whatever. I mean, a hedgehog, a guinea pig, a parakeet. The other thing I just want to mention before I forget is, you might think, well, this probably doesn't happen in veterinary medicine because we have dogs around us all the time. Actually, it's just the same. We have a very high rate of depression, anxiety, burnout, suicidal ideation, and one of the highest levels of suicide of any profession. I was talking to a colleague of mine today at the University of Florida, and they conducted a study, a validated instrument tool, and 60% of his faculty in a clinical department had a level that was at or above burnout. And, that happened during the pandemic, but it was probably there before. And as you all probably have heard locally, but this is nationally, there's a shortage of veterinarians, there's a shortage of veterinary nurses, there's long wait times to get in, long wait times in ER rooms. That adds stress to everybody, including the people trying to provide the care. So there's something about a therapy dog and not so much a dog. And I don't mean one that's just a therapy dog, but if you have a really sick dog in an ICU, I'm not sure you're getting that same positive benefit because that's your patient, just like if you're treating a human patient. So I think that's something. And I just wanted to acknowledge Sally Mallarette back there. Raise your hand. She's been coming to our college for years with first Max, her therapy dog, and now Fiona. And so that's something that, we used to have Wellness Wednesdays and have Fiona come over. So even veterinarians who interact with animals all the time still can benefit, but in different ways than with their patients.
I just wanted to add that for a while before the pandemic, I volunteered at the Ohio State Medical Center at the Ross in one of the waiting rooms. And the pups would come to visit the patients, but it was the people in the waiting rooms who had no idea how their loved one was doing in the surgical procedure. They were anxious and stressed out, and what a relief it was for those people. So it's not just for medical staff too, it's for your patients, it's for people who are in waiting rooms. It's amazing. And Dr. Melnyk, back to the stress that these folks are under, besides something like a comfort companion, what other ways do you know that would help reduce stress for some of the medical staff or veterinary students or anyone in the medical field?
I first want to point out we take a comprehensive, integrative approach to health and well-being for faculty, staff, and students. We are seriously resource-rich at Ohio State compared to a lot of different places throughout the country because not all interventions work for the same people. So you've got to tailor your approaches. We have several wonderful evidence-based programs at Ohio State for faculty, clinicians, students, and staff. And it's really important to also emphasize culture. Culture eats strategy for breakfast, lunch, and dinner. Seriously. You could have the best programs available, but if your culture is not one of wellness, people's behaviors, their stress levels are still going to be high. The other thing, Gail, if I can just mention, why is clinician mental and physical health so important? I'm not sure everybody here is aware, but preventable medical errors are now the third leading cause of death in this country, often made by caring, well-meaning clinicians that are burnt out, exhausted, depressed. So clinician well-being adversely, if it's poor, can affect the quality and safety of health care. So that's why, again, we invest to the level that we do at Ohio State in wellness.
Nechelle, what does support like that mean to you and your colleagues?
The sky's the limit. We are blessed to have tons of resources at the medical center. Sometimes I know that I did the health athlete course, and so there were resources that I wasn't even aware about, but now we're receiving that information on the medical center side, so it just adds to a vast more of resources that we have available to us.
Are these classes that you're talking about interventions? Yes?
Mm-hmm.
Yes. Athlete is an energy management program. So how many of you would like to have more energy that sustains throughout your day. So if you're interested in learning more about this fabulous energy management program, please contact me. We have put so many clinicians, leaders, faculty, and staff through that program with fantastic outcomes.
So we've been talking about medical staff. Dr. Moore, why do you think it is that medical staff seem to suffer so much from stress and anxiety? Is it the fact that they are dealing with life and death situations many times? Is that critical?
Well, I think that, yes, I would say it's dealing with life and death. It's dealing with the emotions of family members. It's dealing with the emotions of the people who are ill. It's dealing with things in their personal life, and all of these trigger stacking things that pile on. And you know, it's many times it's true in human health and veterinary health. It's let's see one more case, one more patient, and it does impact the quality of care that you can give. And I think people in the healthcare profession are very caring, compassionate people, and they feel the stress of not being able to do their best work because of either the pace, short-staffed, overworked, whatever it might be. So I think that's probably some of the things that contribute to that, and it's no different, as I said, in veterinary medicine, and in fact, in some ways worse, because you know, they have to deal with the fact that a dog or a cat that comes in on emergency, for example, that person was not planned or prepared for because it was an emergency. Very few people have pet insurance in the U.S., about less than 4%. And so a lot of euthanasias occur not because of the illness, the seriousness of the illness or the injury, but because of lack of resources. That can just go, that can build and have a tremendous negative impact on the well-being of the staff that are having to deal with that.
I'm not sure who's best to answer this, Dr. Moore or Dr. Melnyk, but other than the fact, oh, you are good friends. He's calling you out. We know that like a dog is soft and cuddly and cute, but what's the research behind why patients, why staff react so positively to these animals?
Well,
Back to you.
I'll give my, first of all, a dog is a conversation waiting to happen. And so let's go outside the healthcare system. Go to your neighborhood. I walk a lot. And if I walk alone, people are looking down, not making eye contact, et cetera. When I have my two dogs with me, they're crossing the street to get to me, or to the dogs. So, you know, I think in times of social isolation in particular, and all, you know, people who work long hours, just having a non-medical person to communicate with and talk about whatever is helpful. And it all, I mean, anything that happens in our body, there's some biochemical reason it is happening. And I won't repeat all of the things that I said before, but I think it's the release of all of those, you know, either the release or the decreased release of all of those hormones and other chemicals that really is why we feel how we feel when we're near a pet.
I think people forget sometimes that we have brief, evidence-based tactics that we can all do to decrease our stress. Pet interaction is one. A dose of vitamin G, when I started with that, for gratitude. I mean, we've got so many studies that show if we would all just wake up first thing in the morning, last thing at night, think of 2 or 3 people we're grateful for. We have scientific evidence behind that too. Abdominal deep breaths taken several times during the day. We've got so much evidence on that too. But behavior change is character building. Believe me, I really know that firsthand. But to get back to pets, Just that brief interaction can cut the sympathetic nerve stimulation and really just help people to calm down in that moment. And that's why it's critical we sustain this Buckeye Paws program and enhance it even more.
Well, our pets don't talk back, so that is also something that's important.
One thing I wanted to also say is, and for those of you who are in the healthcare, whether, and I'll say human healthcare field, there is evidence that if the healthcare worker asks the patient early on in their interaction, do you have a pet? You will build trust with them much quicker. They will reveal information that they might not have revealed before that helps you hopefully be more accurate in your diagnostic approach and not going down a wrong pathway. So if people aren't doing that or it's not a standard part, I would encourage that. The other thing we know is people will do for their pet what they won't do for themselves. So let's say I go in and my doctor says you have cardiac disease, which I don't, but you have cardiac disease and you need to walk and lose 20 pounds, which I do need to do that. If my veterinarian, and I don't treat my own pets, if my veterinarian told me I need to walk Teddy and Travis and have them each lose 5 pounds, I would do that and get the secondary benefit. So I encourage healthcare professionals to prescribe pets for certain reasons. Integrate them into your prevention, your therapy, your whatever, and you will probably have better compliance.
If I can add to that, Rustin and I and social work have a program called POP Care, Pet Owner and Pet Care. We send interprofessional teams of students out to the homes of seniors with chronic disease and their pets. And these students, as an interprofessional team, take care of the people and the pets together as one family. It's fantastic. It's the first model like that in the country.
Nechelle, we've talked about how dogs have helped you, your other staff. So we think the pandemic's over, but we know it's not, and there's a new variant. So how do you go in every day with a positive attitude? Or how do you still walk through those doors knowing that you'll be able to take care of your patients that day?
Well, secretly, we always look to see how many COVID positives we have each day. While we're always watching the news prior to see kind of what the area, what's in Ohio, what are our numbers. But there is that overarching fear that we will hit a second surge or third surge, essentially, with the non-vaccinated population. We'll just take on what comes. We'll pull our buckle strings tighter and we'll do what we need to do in order to get through it again and support each other.
Dr. Melnyk, any wise words from you as we end this regarding stress in the workplace, especially for the medical workers, and if we go back to another COVID predicament?
Self-care is not selfish. When we get on a plane and those oxygen masks drop, we are told, put them on yourself first before you can help others. Clinicians, they want to do such great work in their caring for other people, but they often sacrifice their own health and well-being. Self-care isn't selfish. We cannot continue to pour from an empty cup. So we've got to encourage each other, even if it's just 5 or 10 minutes a day. Do something for yourself, your own health and well-being, because you'll be so much more effective with your families and your patients.
I'm going to take this home with me. Self-care is not selfish. I love that. Thank you, Dr. Melnyk.
I'm glad you said that, because I've been waiting for an opportunity to say, think about what Simone Biles just did. That was self-care. She wasn't selfish, meaning she didn't go out there look, one more time to get another medal. And I know she's getting a lot of criticism from some, but that to me is a very public example of taking care of your physical and your mental health. And if she's not well, others in her arena, her team, her family are not well. So thank you for giving me that.
No, thank you for sharing. I want to remind everyone, we're going to move to questions shortly, in person and live stream with just a few minutes. But I do have a question, and I'm not sure, Dr. Moore, you could answer this, but we've seen these lovely dogs, and they are very well trained. Not every dog can do this, right? Or not every handler knows how to, train their dogs. So how do you train a pup, and how do you know a certain animal's got what it takes?
Well, I am not a dog trainer or a dog whisperer, and anybody that's been around my dogs know that. If they were here without any other dogs, they would be running from table to table looking for pets, not treats. If they were here and those dogs were back there, they would be barking constantly. But, there are ways to, and a lot of it's around positive reinforcement. And I'm not a dog trainer, but a lot of these dogs that go through therapy training or service dog training go through a very regimented program that probably one of them could talk about, and have to get certified. So it's not just, well, I have a nice dog and he's calm. There's more to it than that. I would not be a good dog trainer.
Do we have a question? Step up to the microphone, please. Lainey, I'll give it to you.
Thanks, Gail. I'm curating some questions from our live stream audience as well. Barbara Ray from the City of Dublin asks, how do you determine where and how the dogs will interact with people when your organization is bringing them? She's asking this because she wonders if certain individuals might be afraid of dogs, have allergies, etc., and if that would be a liability. So I'm going to have my sister answer this question. Mary?
First of all, just let me say what a pleasure it is to be here. Appreciate the vitamin G, and I am grateful to be here. It's one of the neatest things I've been able to do in my career over 30 years. And so the answer to the question about, first of all, yes, there's always cultural and personal beliefs around dogs, and we've got to be thoughtful of that. And so we're very cognizant when working through and walking through the healthcare facility and also on campus, because we are expanding into the university with Dr. Moore and Dr. Melnyk's help. We really are, we look for people, how they actually react to the dogs. I have had people, I get off the elevator and I have Shiloh, and I have people that have backed up against the wall and really let me know that they were afraid. And so I'm cognizant of that. We train our handlers to put the dog behind them, back up against the wall, and tell them, we will not come near you, you are safe. And so we do those kind of things. I forget the rest of the question though. Was that it? Yeah, so it's very important that you respect cultures and personal beliefs as well as allergies. So we do have people sometimes that say, hey, we're allergic. But it happens so very rarely for us, so we're very fortunate in that. The one thing I will say about our program too is we do have a master canine trainer. To Dr. Moore's point about training the dogs, we actually interact with that master canine trainer more than 4 times a year, and she recertifies our team annually. So thank you.
Thank you, Mary.
Have behavioral assessments of dogs before they are put into those programs, and I'm not sure if yours does, but clearly these are behaviorally sound dogs.
We also do a fabulous job of tracking outcomes by college unit. So I'm able to tell Mary and Beth These are the 2 or 3 colleges that are experiencing really high levels of stress or depression. So we can prioritize how we will mobilize the dogs.
Carol?
Hi, Carol McGuire. I'm a lifelong dog owner. Actually, I think the dogs have owned me over time, but I've understood and been very grateful for all of the companionship that I've had from these dogs, and I've understood for a long time how important they are and how grateful I am to have had them in my life. But it's only been really in relatively short period of time that we've come to understand the importance of these companion animals. What barriers may still exist with regard to gaining, 100% acceptance of the part that these animals play in our lives?
Well, I think, like anything, 100% acceptance might be more than we can expect. However, there will be people who are always, maybe they're afraid of dogs. Maybe they had a bad experience as a child. They walked down the sidewalk and some, not even a mean dog, but a big dog ran out of the parking lot or the driveway to greet the child, but that's not how it was interpreted. So there are going to be issues around fear. There are going to be issues around the fear of allergies, which, most of that, at least with dogs, is not as severe. Certainly people have more severe allergies at times to cats or cat dander. I think it all comes down to evidence, like Bern said. So the more we can do and the more studies we can conduct, one about the safety. So, the safety of bringing a dog into, say, an oncology ward where people are immunocompromised or something like that. The more studies that can be done to show evidence of safety and effectiveness, I think is how you do it. And at least for those who believe in science and evidence and that's the way I would approach it.
There are also some concerns from leaders in terms of work interruption. But it's like anything else. If you take brief recovery breaks during the day to recharge a little bit, you're going to be so much more engaged and productive in your work. But these things that Rustin and I have just pointed out, it takes good evidence to show the leaders, to talk with people about, and we will continue to gather that evidence.
Thank you.
There are some, I don't know if there's studies or anecdotal, but it's consistent. One thing is university presidents who have a dog are viewed to be more approachable. I think that's probably true of United States presidents. Many of them have had dogs. And some that bite, she said. It's not, I didn't say all.
All right, this is for Nechelle. As a clinical manager, what new things have you learned about supporting your frontline workers over the past 18 months that you will apply, heaven forbid, that you go through another wave, or even just in the future, regardless?
I think one of the main takeaways there is that we saw that stretching our time frame and having presence there, we stretched our schedules. We were there 7 days a week. Of course, we couldn't be there 24 hours a day, but I think the presence of being there with our staff members and them knowing that we're there for them for whatever needs to happen. And then I think the increased communication during the midst of our pandemic is what really was beneficial for everyone.
Sherry Hubbard from an online question asks, can you say something about the role of companion animals in assisting those who are grieving a lost loved one? Could this apply to clinicians who have also lost long-term patients?
I would, well, go ahead. You go, it's for you.
That's a very in-depth question, but I would say definitely they would benefit. You can expand on that.
Well, a lot of this is anecdotal, but I mean, in talking, for example, with Sally, who I mentioned earlier, and she takes Fiona to hospitals and many other places for the patients or elder care facilities or things like that. And I do believe it probably does have an impact, probably the same way it has the impact that we've already talked about in helping someone, get over the loss of a pet or the loss of a loved one. We actually, we have an embedded social worker in our veterinary medical center who is there for our clients. We've had this program, it's called Honoring the Bond, since 1997. Several other schools now have it, but it's really there to help our clients make, as they're making difficult decisions about, end of life, et cetera. But also, it also relieves the burden, or some of the burden, from the clinical staff from needing to sit with the person for 2 hours, which the person needs, but they have other patients to be taken care of. So, I think there's many ways that we can help those people with through grieving of a loss of a pet one or a person.
Hi, Mimi Dane, former CEO at Flying Horse Farms, a camp for children with serious illnesses. And when I was there, we had a canine program for our campers. Campers range from children with heart disease, cancer, gastrointestinal disease, and the children would take the dogs through agility programs, and the dogs were there to greet them. To what extent are there studies about the effect that programs like that are helpful to children who are going through their own version of trauma?
There's a lot of evidence on this type of interaction and therapy with children with chronic illness in particular. It's overwhelmingly positive.
Study of 7 to 8-year-olds, and not necessarily youth with those illnesses, but that of kids in the 7 to 8 year range, interacting with pet builds their confidence. They serve as a confidant, so they will tell their dog or their cat their little secrets that they're not going to tell to someone else, and it builds confidence, self-confidence, and a sense of independence. And in the case that you're talking about, my guess, the fact that a child that may be confined to a medical facility or confined to a wheelchair or whatever, being able to go out and have that agility dog, have them, have that dog go through the agility course, probably has really positive impact.
Because probably, Dr. Moore, those children don't have a lot of control over what is happening in their life, and this is something they can't control.
Another live stream question. This is from Megan Reel. What measures are in place to protect the health and safety of the participating dogs in Buckeye Paws?
So first and foremost, we do have to care both for our partners that we bring with us, our canine partners, and also the safety of our staff as well as patients. And so we actually are so fortunate to have Dr. Rustin Moore and his team at the Veterinary College of Medicine. He actually has his own epidemiologists and others who are looking at the interaction between COVID and other infectious problems between what can be carried into facilities given to dogs and what can dogs, take with them. So we've been very, very interactive with them around some of the issues that came, especially around COVID. And so we made sure that we did a lot of wiping down of our dogs. We have sanitary wipes. We make sure that, especially paws, anywhere that an individual has touched the dog, they have to be wiped down between visits. And we always say to our staff, my friends over here know this, please make sure that You wipe your hands before we pet the dog and wipe the hands after we pet the dog, just like we would with going in and out of any room. And so we have had, I mean, I shouldn't say real out loud, but we've had absolutely no issues with the animals. They also have to have their annual veterinary checks, just like, you know, we make sure they go through all of those shots. And we actually have a record, an employee record on every single one of the animals. And so we are very stringent on making sure that the animals are protected, as well as our staff and our patients. And one thing I will say, just kind of to go back to one of the questions about end of life, this year has been tough on our staff in terms of dealing with end of life. And I just want to thank our, we have some of our MICU staff here that is sitting with us, as well as our management team and our chief nurse. They have done an amazing job of supporting each other, but we know also that they have been stretched. And I have seen the ability of the animals as they are dealing with the family, but also with families. They have the dogs interact very, very well with some of those end-of-life issues. So I've been witness to it, so I can answer that a little bit. So thank you.
Well, a round of applause for our medical health care workers that are here. Thank you for what you have done and continue to do. Last question.
That's a great example of real-life interprofessional practice where members of the healthcare team, everybody is working together, and we are focused on that at Ohio State across all the health sciences plus others. So just thought that was a really good example of something happening in real life.
Hi, my name's Pat Rhodes, and I don't know if it's just in my family where the dogs are on antidepressants and anxiety meds, or I don't know if that's the way to treat the dogs who are having those problems, or if there's a better way.
Guess that's me. You know, dogs like people, they're all different, and some of them do have various behavioral or mental health issues. You know, some of them in older dogs, there is something called canine cognitive dysfunction, and that's essentially dementia. But there are ones that have fears. They're fearful of thunder. They're fearful of another dog. They are protective of their food bowl. They're, you know, all sorts of things. And so I would say the best thing to do would be to work with your veterinarian, and or if there's things that are beyond that, you know, it's a difficult situation, there are actually veterinary behavioral medicine specialists that's all they focus on. And we have those employed. There's not very many of them around, but we do have them in our facility, and about 90% of the cases they see are actually dogs, and 10% cats. And of those, most of them are because of some level of fear or aggression toward another animal, toward a person, et cetera.
Thank you. Thank you for the question, and thank you all. As always, I wish we had more time. I'm going to hand it back to Steve.
Well, I hope you enjoyed today's forum. I went out looking for dog puns, but it was rough. But it was possible. There's two. Please make plans to join us next Wednesday as CMC presents Game Changer, the new NCAA name, image, and likeness rules. Our thanks to our forum sponsor, the OSU Wexner Medical Center and Health Sciences Colleges, and to the Emergency Response Fund of the Columbus Foundation for presenting our live stream in partnership with the Columbus Dispatch and PNC. And thank you to our virtual seat patrons as well. Our special appreciation and thanks to our speakers, Rustin Moore, Nechelle Marlowe, Bernadette Melnyk, and our host Gail Hogan. And special thanks to Mary Justice and Beth Steinberg for bringing Shiloh and his team. Unfortunately, I can't be like Oprah and say everyone gets a puppy, but no. Thank you for joining us. We could not do this without you. We do look forward to seeing you next Wednesday as the Columbus Metropolitan Club presents another community conversation. Thank you. Excellent job.